My name is Karen Detering and I'm the Medical Director of Advanced Care Planning Australia. Broadly speaking, advanced care planning is about asking people about what they would want if they couldn't make their own decisions regarding medical care. Advanced care planning involves talking to a person about their goals and values and beliefs and their preferences for medical care. It usually involves helping the person to determine who their substitute decision maker would be, and the substitute decision maker would only have a role if the person themselves was unable to make their own decisions. If the substitute decision maker, however, is in a position to be making decisions on behalf of the person, then they need to know what the person would want them to do. So essentially it's a conversation, often a facilitated conversation, although it can be done outside of the health sphere as well. And it's basically trying to get these elements worked through and hopefully documented. In terms of the role that the GP has in advanced care planning, the GP would be in a great position to give information about advanced care planning, give information about the person's health conditions and the sorts of things that may happen in the future, so to help the patient think through what might go on and what types of decisions they need to make. In many states and territories, the documents need to be signed by a doctor, and the GP is in a great position to be able to do that to support the process as well. In general practice, there's many opportunities to have an advanced care planning conversation. Some of these might be at the key appointments like the 75 plus health check or other key appointments, but also there are opportunities during the consultation if a person actually brings it up, and there's a number of prompts that might suggest that that could happen. So for example, if somebody made a comment that they were really struggling with their treatment or that they didn't want to go back to hospital now. There's no requirement to do any particular component of advanced care planning, and in fact a person doesn't have to do any advanced care planning. But if they have a suitable person that could be their substitute decision maker, it is a good idea for the person to appoint a substitute decision maker to be their voice if the person themselves couldn't actually speak for themselves. And so we would then help the person choose the right substitute decision maker. And essentially it's somebody they can trust and who is likely to follow what they would want in a situation where the person themselves couldn't decide. So the responsibilities of the substitute decision maker are to actually act and make the decisions that the person themselves would make for themselves. So it might be that they've had a discussion with a patient when they were competent, and it might be that they're to follow some very specific preferences that have been expressed, or it might be that the substitute decision maker has been given the authority by the patient to actually have a discussion with the healthcare team and then to make the best possible decision at the time. And many families will use the relationship as part of the importance of the substitute decision maker. A substitute decision maker does not need to be a family member, although often it is. Developing an advanced care plan for people that don't speak English or from Aboriginal or Torres Strait Islander background requires some extra care. Particularly, there may be different cultural and religious sensitivities that need to be discussed. And it's very important in these situations to make sure that we're not putting our own values and views onto the patient and their family. So that is one circumstance where extra care may be required. Extra care may be required when developing advanced care plans for people that have mental health illnesses, and particularly determining whether they're actually competent to now complete certain components of the advanced care plan, because obviously with mental health the capacity can vary over time. I think also extra care is required where people feel quite isolated and maybe developing an advanced care plan. Perhaps they have no one to support them, and so they may want to actually write down in detail what they're hoping will happen when they can no longer make capacity. Another group where extra care may be required is where patients may, for example, have same-sex partners, and there may need to be a little bit of sensitivity around that, particularly where the person may be wishing to appoint their same-sex partner, perhaps instead of a family member, and that may create some concerns as well. Advanced care planning is a process over time, and it benefits most from having a range of health professionals involved in the team. The doctor has a role in terms of providing medical information and some support for the advanced care planning process, and may be the one that needs to sign the documents. Nurses are very well placed, particularly in hospitals and in general practice, to facilitate the conversation, and they perhaps can facilitate some of the earlier components of the conversation with people. Allied health professionals often have a role as well when they're interacting with the patient. They may be going into the person's home or maybe working with them elsewhere in the community, and again have the opportunity to facilitate, to raise concerns, and also to pick up on concerns that patients have and encourage them to have the advanced care planning conversation. One of the key things in involving our multidisciplinary teams in advanced care planning is making sure that we have a mechanism to document the components of the conversation as they develop, so that the next health professional can pick up where it was left off and take it to the next step. Otherwise, it might be that we have lots of very similar conversations, but we don't actually take the conversation to its natural conclusion. I think advanced care planning is really important for many of the Australian population. So it's really important for you, the health professional, to get involved in the conversation. It's important to use the skills that you already have and start the conversation going. And you may be surprised. Often I'm told that these conversations are hard. I believe they are often not as hard as we think they might be. And in fact, often they can be very uplifting for the person themselves that's having the conversation, and you, the health professional, as well.